My name is Niwaini Desilaudesaro with your last digit of name 084. Spondylitis is a condition where there is a defect of unilateral or bilateral of the pars interarticularis that is considered the bridge between inferior and superior articular surface of a single vertebrae. The most common type of spondylitis are cervical and lumbar of vertebrae. Spondylitis is typically asymptomatic, but 10% of those affected experience symptoms such gradual onset low back pain that worsen with activity of lumbar hyperextension. These conditions are related to patient age, exposure of significant spinal trauma, congenital neurovertebral canal, and also specific athletic activity.
Hello, Doctor and friends. My name is Geraldine Rahel Gutama with the last three digits student ID is 100, and now I'm going to present about the problem formulation, the objective, and the benefits of this student project. So there are 9 problem formulation here, starting with the definition of spondylosis, questioning the clinical manifestation, questioning the etiology and pathophysiology, the epidemiology, the risk factor, the evaluation needed for spondylosis, how to diagnose spondylosis, the treatment and management of spondylosis, and lastly, the prognosis of spondylosis. And here are the objectives to answer all the problem formulation before. And the benefits of this student project is to enhance the knowledge of and understanding of spondylosis. And also, the student project is also expected to be a reference for other research related to spondylosis. That's all from me. Thank you.
My name is Jeremy Natnal Dihaja, and the last 3 digits of my student's number are 216. Now, we will move to the chapter 2, which is the content. And to point 1, which is the introduction to spondylosis. The first definition of spondylosis, a degenerative spinal condition caused by wear and tear changes in the intervertebral disc, facet joints, and vertebral bodies that can cause pain and disability by compressing nerves. It is most common in the cervical and lumbar regions and occurs more frequently in people over the age of 50. The female to male ratio of spondylosis is 6:1, and the majority of cases occur at L4 and L5 of the spine. Newman and Stone coined the term degenerative spondylolisthesis, which is the dislocation of one vertebra over one another caused by degenerative changes in the lumbar facet joints. Cervical and lumbar spondylosis are the most common forms of spondylosis.
Next, my name is Ivy Lonita Augustine with the last 3 digits 150, and I will explain the clinical manifestation. Some patients with degenerative spondylosis develop low back pain that is mostly caused by deteriorated and subluxated facet joints, segmental instability that strains in the facet joint capsules and ligaments, compensatory muscle spasm to the instability, and residual of the stenosis that can cause radicular pain. Severe stenosis also can lead to bowel bladder dysfunction. Mechanical and vascular factors induce stenosis symptoms, while neurogenic claudications, which is brought by the blood, hypoperfusion as a result from the compression of nerve roots and manifest as discomfort in the lower limbs with varied walking distance. When the listed worsens, facet hypertrophy, yellow ligament thickening, and disc bulging may increase compression and occasionally cause the symptoms of cauda equina syndromes, which, unlike its acute appearance in herniated disc, manifest insidiously and silently in spinal stenosis. In cervical spondylosis, the symptoms lead to a progressive degenerative condition, including axial neck discomfort, radiculopathy, myelopathy, or combination of the symptoms. Patients frequently report headache, vertigo, nausea, vomiting, tinnitus, angina, and palpitation as side effects. According to the first Indian study revealed by Sharma, the symptoms significantly decrease in intensity and frequency, and hypertension significantly improve. Well, that is all from me. Thank you.
My name is Puta. This is Cecilia Sujana. Its last digit name is 241. I will be continuing the explanation about etiology and pathophysiology of spondylosis. So, spondylosis involves a degenerative cascade that produces biomechanical changes in the cervical spine, manifesting a secondary compression of neural and vascular structures. An increase of the keratin-chondroitin ratio prompts changes to the proteoglycan matrix, resulting in loss of water, protein, and mucopolysaccharides within the intervertebral disc. Desiccation of the disc causes the nucleus pulse to lose its elasticity and ability to bearing the weight. Thus, it begins to herniate and form a compression of the cervical spine. Further compression produces significant alteration in the load distribution. That is all from me. Thank you.
Let me introduce myself. My name is Jen Warga with last three digits of student number 134. Let me continue with the etiology and pathophysiology. As kyphosis progresses, the annular and Sharpie fibers separate from the vertebral margin and reactive bone formation occurs. These osteophytes can form along the ventral or dorsal edge of cervical spine and then project into the spinal canal and intervertebral foramen. Disturbance in the load balance along the vertebral and intervertebral joints produce large axial lobes, induce joint hypertrophy or enlargement, and accelerate osteophyte formation into the surrounding neural foramen. These degenerative changes result in loss of lordosis and mobility of cervical spine and a decrease in diameter of the spinal canal. Symptoms that may occur afterwards are axial neck pain, cervical myelopathy, and cervical radiculopathy. Cervical spondylosis can also be accelerated by spinal trauma, congenitally narrow vertebral canal, dystonic cerebral palsy affecting cervical musculature, and athletic activities. That's all from me. Thank you.
My name is Karen Angela, and my student ID number is 210251116. So spondylosis occurs mostly in the lumbar spine, although there are some cases of the disease affecting the cervical part and also some affecting the thoracic part. Cervical spondylosis is seen mainly in C6 until C7 at an overwhelming percentage of 80% of all CS cases, and followed by the C4 until C5 segment. Lumbar spondylosis, on the other hand, is mostly seen in L4 until L5 in 85 to 95% of the cases, and followed by the L3 to L4 section. This degenerative disease is most common after 50 years old, with a percentage of between 80 to 90%. This correlates with a peak incidence of spondylosis between the ages of 40 to 60, although it may begin as early as the first decade of life. The male to female ratio of the disease is 3:1. In the Inuit Eskimo population, the prevalence has been recorded as high as 50%. Even so, the number falls drastically to 9% in Koreans and 6.4% in Caucasians. Furthermore, the percentage for Japanese and Afro-Americans are 4 and 2.8% respectively. The number may even reach as high as 47% in athletes.
My name is Anjani Prabandani with last three digits 148. So I will explain about the risk factors of spondylitis. The first is gender. Diagnosis of spondylitis is more common in men than in women because men tend to have more severe symptoms. In addition, the diagnosis in women is often overlooked or missed. And the next is genetics. People with gene HLA-B variation is more likely to have spondylitis, but not everyone with this gene variation will get this disease. And the third is age. The symptoms of spondylitis commonly occur in the age range of 17 years old to 45 years old. And last is environment and lifestyle. Several studies have stated that smokers and people who rarely exercise have the higher risk of suffering spondylitis. Thank you.
Thank you for the time. My name is Gede Ariana Saputra with the last three digit number name 018, and I'd like to discuss with you guys about the diagnosis and evaluation method of spondylosis. Just like any other orthopedic disease, the main evaluation method for spondylosis will always be radiographic studies. There are 6 main radiographic studies that is mainly used to diagnose spondylosis. The first one is X-ray or plain radiography. That will always be a suitable first line for every major orthopedic disease. And then magnetic resonance imaging or MRI that produce a more detailed structure but has its drawback, which may sometimes produce a false positive result. And then a computed tomography or a CT scan that is less sensitive than MRI but proven useful for patient that has a contraindication in MRI. And then a CT myelogram, which is basically a CT scan with injection of contrast or myelography. And then a discogram, and finally electromyogram.
Hello, my name is Gusti Agung Saraswati. My last 3 digits number 056. Now I will explain about differential diagnosis. The differential diagnosis of cervical spondylosis includes cervical sprain and strain, cervical myofascial pain, cervical disc disease, cervical fracture, chronic pain syndrome, fibromyalgia, adhesive capsulitis, brachial plexipathy, chronic outlet syndrome, carpal tunnel syndrome, cubital tunnel syndrome, Turner syndrome, multiple sclerosis, vitamin B12 deficiency, amyotrophic lateral sclerosis, Barrer syndrome, vertebral metastasis, and discitis or osteomyelitis. That's all for me. Thank you.
My name is Made Ayurana Parawita with last 3 digits student ID number is 226. So the management of spondylosis cases can be non-operative and can be also be surgical procedures. Non-operative treatment aims to reduce pain, help to maintain bone function as optimally as possible, as well as prevent further damage. In non-operative treatment, there are 2 types of treatment, namely drug therapy and also exercise therapy or physiotherapy. Some of the anti-pain medicamentos that can be administered are NSAID, muscle relaxant, antidepressant, and corticosteroids. And corticosteroids usually in patients with more serious cases. In exercise therapy, usually takes 15 until 20 sessions between 30 and 45 minutes duration over a 3-month period. In contrast to non-operative treatment, in operative therapy, there must be indication for surgery, including the failure of non-operative treatment for 3 months in the process of pain relief, persistent or recurrent with or without neurological deficits.
My name is Tiffany Cecilia and now I will explain about the prognosis. Patients with spondylolysis usually have a good prognosis. Asymptomatic individuals do not require specific treatment or modification of activities of daily living or exercise. A recent meta-analysis showed that 92% of patients were able to return to play with conservative treatment and 90% of cases were surgically guided. Thank you.
Thank you for the opportunity. My name is Rosa Velani with 3 last digit of student number being 168. And now I'll be presenting about the conclusion and suggestion of this student project. So, spondylosis is a degenerative spinal condition caused by wear and tear changes in the intervertebral discs, facet joints, and vertebral bodies. The clinical manifestations are recurrent low back pain, stenosis, cauda-equine syndrome, axial neck discomfort, radiculopathy, myelopathy, or a combination of these symptoms. The pathologic mechanisms are age-related changes in structures surrounding intervertebral disc and cervical spinal elements cause narrowing of spinal canal in intervertebral foramina. The epidemiology are 80% to 90% happen by the age of 50, 4.4% to 4.7% in children and adolescents. Male to female ratio is 3 to 1. 80% cervical spondylosis happen at C6 to C7, and 85% to 95% lumbar spondylosis happen at L4 to L5. The risk factors of spondylosis being that spondylosis is more common in men, people with HLA-B27 genes, age of 17 to 45 years old, smoking, rarely exercising, exposure to environmental toxins, and history of previous infections. Diagnosis methods are X-ray, CT scan, scintillogram, discogram, and electromyogram. The managements are operative and non-operative, which includes drug therapy and physiotherapy. The prognosis of spondylosis is usually good. Lastly, we hope that the readers will find this article useful. We recognize that this paper is far from being ideal. As a result, constructive criticism and suggestion will be extremely beneficial in improving this writing. We recommend conducting additional research information regarding spondylosis. That's all from SGD Basics. Thank you.